The Public Health Accreditation Board is the nation's accrediting body for governmental public health practice in the United States. The Public Health National Center for Innovation is our division that researches insights and innovations for the future to inform accreditation standards. To date, we have 235 accredited state, local, tribal health departments, plus the entire local health department system in Florida, who went through accreditation altogether. We have another almost 200 who are in the process, covering 70% of the United States population. When the Public Health Accreditation Board was established about 10 years ago, one of the fundamental cornerstones of that establishment was health equity. The idea was that high-quality public health services should be available to all of the U.S. population, regardless of where they live. So whether it's a small rural area or large metropolitan area or every kind of area in between, residents and people who live in the United States should have access to high-quality public health service. Since that time, we have added increased emphasis on health equity in our accreditation standards. And we ask health departments going through the accreditation process to talk about their work on health equity, reducing health disparities, and addressing the social determinants of health.
Over 80% of accredited health departments have indicated that they work specifically on health equity. Examples of some of the topics that they address include community transportation systems, access to safe places to engage in physical activity, and of course, access to healthful foods. Once the health department is accredited, they submit an annual report to the Public Health Accreditation Board to maintain their accreditation status. We're very excited when we see these reports because so many of them talk about continued efforts around health equity, particularly developing their own capacity to address health equity. Examples of some of the things that are reported include the development of an internal health equity office or division, embedding health equity in their policies, and importantly, expanding and deepening their partnerships with the community.
PHAB is doing a number of things to encourage health departments to build resilience and health equity. One of those is the development of the Public Health National Center for Innovations, and we actually exist to encourage innovation in health departments. And a lot of that work takes place around looking at what the state of the field is with regard to health equity and developing new ways to address health equity and advancing those in other health departments across the country. The Public Health National Center for Innovations at the Public Health Accreditation Board has made 9 grants to health departments, primarily state and local, to address a broad category of work around innovation. But all of them actually have a big focus on health equity in their communities. And so through these grantees, we're learning about what are the new ways to address health equity in communities.
At the Rhode Island Department of Health, this is our strategic framework. By knowing we need to shift investments from clinical care setting, primarily high acuity care that's costly, to prevention-oriented primary care, community services, we have 3 leading priorities for accomplishing that: addressing social, economic, and environmental determinants of health, eliminating disparities of health, and promoting health equity. So regardless of the zip code you're from, you have access to living the healthiest life you can live in the healthiest community. That's achieving health equity. And ensuring access to quality health services for all, including our vulnerable population.
I'm very excited that the Public Health Accreditation Board is committed to continuing to encourage health departments to engage in health equity work and transform public health. Health departments can develop and utilize community assets and strengthen community resilience, build community social capital, and importantly, strengthen and deepen authentic and effective partnerships with their community to address health equity and improve community health.
what I see when I look ahead to the future and the impact of accreditation on health equity is our continued work and partnership with the health departments going through the accreditation process to keep a sharp lens focused on health disparities and on health equity in general, so that we do achieve that goal of ensuring that no matter where somebody lives or who they are or where they come from, that they have access to the same level and quality of public health services.